Regarding the test itself, the outpatient facilities for Japanese returnees and potential contacts, there are about 900 such facilities nationwide. So the patient visits the outpatient facilities. That's what we are thinking, because otherwise, conducting the test per se would have the risk of causing infection, and we have to make sure that the separation between those patients and other patients. So we want the patient to come to the nearest outpatient facilities, not just going to any outpatient facilities. I understand that, but the judgment whether the test is required or not, at the level of local doctors, that judgment can be made. Am I correct in assuming that the local doctors can make that judgment whether the test is required or not? Regarding the final judgment, that's done by the outpatient facilities for Japanese returnees and potential contacts. Those are the medical facilities that have good measures to tackle the infectious diseases. Even the local doctors find it necessary for the patient to have that test. There are certain cases where the outpatient facilities do not think it's necessary to perform a certain test. All right, I understand. Then, so in the past, you had to go through the public health center, but it can be now skipped, and the center makes the final judgment. And whether the test is performed or not with regard to those conditions, you had certain conditions so far. Several days that you have to have the 37.5 or higher temperature. No changes. One of the conditions is that if the doctor finds it necessary, so together with the quantitative standards, there is a qualitative standard that criteria by doctors. So the doctors at the outpatient facilities deems it necessary. Then it's even without pneumonia, even the lower temperature than the 37.5. If the doctor at the outpatient facilities deems it necessary to perform a test, then the test is performed. So as a result of the comprehensive judgment, this has been conducted since February 27th, from February 27th. But before the coverage by the public health insurance, the consultation with public health center, that round was necessary. That was a must. But after March 6, the consultation with Public Health Center, that round is no longer necessary. So in a flexible manner, the doctors can make a judgment with his or her own discretion. Excuse me, so the number of tests performed and the number of the results that tested positive, do you have the percentage of such numbers? At the moment, I'm sorry, I don't have the numbers. We need to calculate. You want to know the ratio, percentage. Well, on the home page, there is information about the domestic cases, excluding the chartered flights and cruise vessels, the suspected new coronavirus cases. In them, 8,771 cases. That's the total number, of which PCR positive cases, 498 tested positive in the PCR as of 1,800 yesterday. With a simple calculation, the ratio of the people who tested positive can be computed. I don't have a calculator with me, I'm sorry, I can't do that.
In the front row. Thank you. Blake Essex, CNN. Japanese health official told me that the reason that the 3,700
3万7000人の乗客とスタッフが戦場で検疫検査を受けたのは陸上に設備がないからと聞いたんですけれども。
scenario like what's playing out in Italy, South Korea, China, Iran.
I apologize. Could you repeat the question once again? I apologize for that.
So, a healthcare official from the Japanese government told me that the 3,700 people on board the Diamond Princess were quarantined on board the ship because there were no facilities on land that could deal or could isolate and quarantine them. If a worst case scenario plays out here, like what we're seeing in Italy, South Korea, Iran, China, is Japan ready to deal with that worst case scenario?
要するに最悪のケースがイランとか韓国とかイタリアみたいな最悪のシナリオが起きた場合に日本の医療機関の数が足りるのかと。よろしいですか。
My name is Shimada of MHLW. The other day, March 6th, we sent to the prefectures this letter. If the number of patients increase under the worst case scenario, please come up with the estimate of number of patients, and in order to be prepared to the increase of patients, please consider what measures you can take in terms of the number of beds and number of respirators. There would be difference locality by locality in terms of the peak and the number of patients at the peak, and they would respond, and MHLW will provide support to those municipalities, including technical advice.
So, Ms. Ritz.
Thank you again. My question is about, going back to Nishimura's question, I know that it's premature to say what measures you think have been most effective, but do you have any explanation as to why Japan has such a lower caseload or seeming, mortality rate than surrounding countries?
Let me confirm your question. Why the number of deaths is so low in Japan? Is that the question? Or are you asking why the number of patients is low? Both. At the moment, we are making all out efforts to implement whatever measures are available, and infection is emerging on nationwide basis, but first we are responding to clusters, and we are taking measures against those clusters. And to a certain extent, we have seen effect through our measures against clusters. And other than that, we've taken measures such as closure of schools, and workplaces have also introduced various initiatives. Large-scale events, to the extent possible, are being canceled. So because of effect from a variety of measures, we are at the current status. Of course, are we being able to capture all patients without any leakage? I'm not intending to say that. I might have given the wrong impression to respond to Ms. Motoko Rich's question that we're capturing all of the potential patients, and I apologize if I've done that. But we are developing sufficient test system on nationwide basis, and to a certain extent, we believe that we've been able to capture a significant portion of Japanese patients. Related question, but in other countries, they are taking similar measures, but they are seeing explosive surge of patients. But why only in Japan you haven't seen surge of number of patients? Why is Japan alone being able to control? Are there hidden patients who are infected? I'm suspicious. In the case of France, events are completely banned, but in Japan, the government has only made a request. But even then, the rate of increase of patients is slower in Japan than in France. So why is that? It's difficult to just reason that as due to the effective measures you have taken. First of all, we have concentrated on cluster response. This is not unique to Japan. WHO, Singapore, Hong Kong, in principle, they have applied this methodology to control, and this has proven track record. So by implementing such proven track record measures, we've been able to tackle clusters, and we are making efforts for containment by implementing such measures. And that's not the only factor. There could be other factors like geographical factors. And other than cancellation of events or banning events, there are other measures, and fortunately, we've been able to maintain the status quo. If there is an explosive outbreak, then there would probably have been concentrated areas where there would be sudden surge of serious cases. But fortunately, we have not seen such phenomena. But at the same time, we don't know when it could occur. It may occur at any moment. And that's indicated in the opinion of experts. We don't know when there could be an explosive outbreak or explosive surge in the number of patients. They admit that. So we are preparing for that scenario and are making available various measures. On that point, related point, in Japan, the number of tests is low. That is leading to the number of patients being low. Don't you agree? In other words, the requirement for people to accept people to take tests. You said that with the doctor's judgment, now patients can receive tests. I haven't done my comparison, but could that be one of the reasons why the numbers are so different between Japan and other countries? In principle, according to our understanding, regardless of the country, I don't think there is any country that are offering tests to all people who request. some contact history or travel history or suspicion of pneumonia. These are the conditions that they apply to perform tests to people. And Japan has the system to have those people receive tests, and we do have the capacity to offer tests to those people. And this is the current status in Japan. So it's not that we are underestimating.
Thank you, Rebecca from CNN. Just to follow up on that point, I wondered if Japan would consider bringing in processes like the drive-through testing that we have seen in South Korea, which has been quite successful in anybody who is interested in getting a test for free can just turn up, and it lowers the risk of infection of medical workers at the front line. And it does seem that South Korea is being very aggressive in seeking out all cases, even if they just have cold or flu-like symptoms, they do not have any trace of pneumonia on their lungs. And it does seem to be an effective approach to making sure that you have found all of the cases in society and they're not sort of spreading it to more vulnerable patients.
The concept of testing would depend on the medical service system of each country and the measure to respond to coronavirus in each country. So I believe that there would be differences depending on the system of each country. In our case, we don't think that the test is omnipotential. Even if the result is negative, you don't know whether the person is truly negative, and even if the test result is negative, that is no proof that that person is not infected, and that is no proof that that person will never ever become infected. But from the public health perspective, I don't think there is any significant meaning in providing tests to everyone who asks. And finite resources, we say that capacity is being increased, but there are limits. So how do we allocate the resources? That perspective cannot be dismissed. For example, 30 million influenza tests is done every year in Japan. If we do the PCR test to all of them who have the symptom, flu-like symptom, we would have to have the capacity of 30 million, which would require a huge budget. So we are trying to come up with the best mix and allocation of resources.
About drive-through tests. Japan as a whole, using a car and having oneself examined by medical professionals, what's the ratio of such people? Some people walk, some people take the train, and then some people take those to medical facilities. I cannot generalize, but in the car park of medical facilities while you are still waiting for them. And then in some cases, I have heard that they could get examined in the car. Those things need to be studied or sorted out. But at the moment, we are not thinking of introducing that kind of a system nationwide at the moment. Ms. Washington Post, Kashiwagi. Sorry to keep asking you questions. A very simple question about the test regarding the patients. You mentioned that the doctor can make the judgment whether test is required. That the outpatient facilities. So you go to the outpatient facilities, and then the specimen has to be taken there. And the doctor will inform the patient as to which outpatient facilities he or she should visit. And secondly, in the process of increasing number of tests, I think you mentioned the private testing institutes laboratories are also utilized, but could you share with me the relevance of those private testing institutes under the current scheme? First, those outpatient facilities for Japanese returnees and potential contacts, as you can see in the flow chart. For instance, the family doctor or general medical institutions, if the patient goes to family doctors or general medical institutions, there are two pathways. One, the patient or the doctor makes a phone call to the call center for Japanese returnees and potential contacts, and then goes to outpatient facilities. That's one way. And there's another. Family doctor from the general medical institutions, the referral to the outpatient facilities for Japanese returnees and potential contacts. So there are two ways. About the private laboratories or private testing institutes, how they get involved, as you can see in the handout. The outpatient facilities for Japanese returnees and potential contacts, this is a medical facility, and directly the specimen can be submitted to the private testing institute, private laboratory. Did I answer your question?
Questions? Okay. Well, okay, please.
Blake Essex, CNN. So regarding the Olympics, you guys had talked about the reality that clusters will continue likely to pop up around the world, potentially indefinitely at this point, who knows. Has the discussion been made or had at this point of whether or not you guys are willing to expose the people living here in Japan to hundreds of thousands of people from all over the world coming to celebrate the Olympic Games in just a few months?
Regarding the Olympics, to be honest with you, it doesn't just concern Japan alone. We have to really think in the context of the international community, the IOC, WHO, JOC, obviously the government of Japan, working on this, creating a task force and sorting out issues. And this is something that should be, the future direction should be decided, studied in this context. It's just some supplementary comment. So that we have been working on the preparation so that we can hold the Olympics. And to that end, we have been making utmost efforts to contain this infectious disease. Excuse me, I think the expert meeting was held yesterday. One of the experts, I think just one of them, for a few months or in certain cases, there's a possibility that this may continue into the next year. So regarding that perspective, is that the concept or the perception that's shared by many experts in the expert meeting? Excuse me. I have heard about that comment, but I was not participating in the meeting directly. So I'm sorry, I don't really know how many others shared that view. Having said that, how measures will be taken, the various factors will have to be taken into consideration. It's difficult for me to speculate. It can be quite a long time. I can't really tell you how long it will continue.
Are there any other questions? If not, I'd like to conclude today's press conference. And thank you very much for staying until late. Thank you for joining us.